Good morning. Thanks to Jay and Vicki for interpreting this morning. We'll run through the numbers real quick. In Hamilton County, the number of positive cases for COVID-19 sit at 65,148. Hospitalizations are at 2,361, and the death toll in Hamilton County is 455. The increases in all cases, the increases of positive cases is 3,217. The increase for hospitalizations week over week is 86, and week over week increase in deaths is 14. So, let's talk vaccines for a moment. Vaccines and vaccinations continue to be a challenge in Hamilton County. And as eligibility increases, the number of doses is not even staying constant here in Hamilton County. So let's talk about this for a second. And these are decisions, by the way, that are being made at the state level. Governor DeWine and the Director of Health in Columbus are making decisions that we are abiding by and responding to in Hamilton County. But I want to be very clear that these decisions are being made and we are trying our best to keep up and to provide information that's accurate to the local community here in Hamilton County. The overall picture is that, as we've said before, the eligibility is starting to expand for people in Hamilton County. So, as you all know, last week, Beyond 1A, the health care providers, congregate settings for seniors, those were the folks that were eligible to receive the vaccine in 1A. We are still not through 1A. We're most of the way through, but not quite finished. And as of last Monday, 80-year-old and over individuals were eligible to get the vaccine, which is great. We really do want to start to vaccinate folks throughout the county. The challenge here is we don't have enough doses to accommodate that kind of expansion. And so we're doing our best in trying to get people vaccinated as quickly as possible. Well, as of this Monday, 75 years and older are eligible. So that's a big jump. And let me give you an idea about the population that we're talking about. So in Hamilton County, those over the age of 75 number just over 54,000. Next week on Monday, 70 and older will be eligible. So that population's about 84,000 in Hamilton County. And then the following week, 65 and older will be eligible. And as we've said before, that's just over 128,000 people in Hamilton County. Unfortunately, the doses that we're getting are not coming anywhere near keeping up with those numbers. To give you an example of that, I believe it was last week, we received about 8,000 doses, and this is total, right? This is the amount going to the hospital systems, to public health, to the pharmacies. This is the whole number of doses that are coming into Hamilton County. That number was around 8,000. This week, correct me if I'm wrong, Greg, it's around 11,000, so that's the total. Next week, our understanding is we're getting about 9,000. So we got a question not too long ago about, well, you know, if we're always going to see at least the same, if not more doses week to week, why can't we do more? We're getting less doses next week than we have this week. Again, this is out of our control, rather frustrating, I'll admit, and really hard to plan for. Because we're ramping up, we're ramping up the capacity. I know the hospitals are doing the same thing, along with the city and county public health, and yet the doses are not remaining constant that are coming into this community. So the eligibility is going up, and the doses are actually going down. That is not a good scenario. And so, we've advocated to the governor. I know the mayor's done the same. I know the health commissioner's done the same. I've done the same, and said, look, we're really trying to be good partners and keep up, but it's very challenging. The other challenge is for people to understand how to sign up. I've heard from a lot of constituents, whether it's via email or over the phone, about the challenge of getting signed up. And I understand that. It's not easy. We're trying to make it as simple as possible, but it's not perfect. And I think all of us would admit to that. That said, we do have a common site where people can go for information and try to navigate how to get signed up. That site is testandprotectcincy.com. On that site, you will find icons that represent the hospital systems that are getting doses, public health systems that are getting doses, including Norwood and Springdale. You're going to see the pharmacies that are getting doses. And so it is up to the individual to decide where they want to sign up, because there's contact information for all of the above, whether it's a website or a phone number. If you choose to, if you're in the Mercy Health system, for instance, choose Mercy Health and go get signed up. You can also sign up with City Health or Public Health in Hamilton County. So it's really up to the individual. But it is a navigational tool where we're trying to put all that information in one place so that it's just a little bit easier for people to get signed up. If an individual is either uncomfortable or does not have the capacity to get online, which, by the way, is a lot of the senior population, there is a number to call, and that hotline number is 211. I actually went over to 211, was that this week or last week? I can't remember. Visited, thanked them for doing the work. United Way has been a fantastic partner in this, with Moira Weir at the head. They are answering a lot of phone calls right now, but they are built for it. They have expanded the capacity over there. So if need be, if you're still confused, call 211. You're going to get a live person on the phone. If the phone lines are full, leave a message. They will call you back. You will get a live person on the phone. Whether it's immediate or eventual, you will talk to someone and they will help you navigate how to get signed up. I listened in on a couple calls. The people are doing a fantastic job, and kudos to them. But anyway, that's another way to get signed up and to get the information that you need. So, that's kind of where we sit. It's a challenging time. We really want to get people vaccinated. People really want to get vaccinated. We just don't have the doses to do it. And we are advocating, but if you have a frustration, I should say maybe, with how people are being prioritized, groups are being prioritized, reach out to the governor. He's the one setting that list. I think he does need to hear from people. I am trying to advocate on behalf of the county from what I'm hearing from people and some of those frustrations, or reach out to your state rep or your state senator. That is the appropriate way to have your voice heard. So we're going to move to Greg, but I do want to mention that Renee Mahaffey Harris is here. She's the president and CEO of Closing the Health Gap. We have been working, and she has been working diligently to try to make sure that everybody in Hamilton County has access to getting signed up for the vaccine. And so she has been doing quite a bit of work with hard-to-reach communities, hard-to-reach people in our community, to make sure that we're not missing the mark there. And so she's going to elaborate on that work in a couple minutes. But first, we're going to turn to Greg for the trends and the numbers.
Good morning, and thank you, Commissioner. So I'll start off by saying this week has had a lot of positive news, including some of the decreased cases that we've been having here in Hamilton County, less hospitalizations, and probably most importantly, vaccination clinics continuing, although not enough. We need more vaccinations here in Hamilton County. I want to remind everyone that if you feel sick, please keep sick at home. There remains a lot of opportunity here in Hamilton County to get tested, so feel free to hop on to the Health Collaborative's Test and Protect website or our website and find out information on how to get tested. We know that one of the most important tools still for this pandemic is keeping sick at home and not spreading COVID-19 if you have COVID-19. Taking a look to some of our case numbers, you can see over the last couple weeks, we have seen a decline in the overall number of cases. Our last peak was on January 14th, and since then cases have continued to decline at a nice rate. Over the past 7 days, our team has been seeing about 435 cases per day on average. This compares to the week of December 10th when we were up at 716 cases per day. This is a great trend, and we are hoping to continue to see these cases continue to decline. I continue to remind folks that there does remain a lot of active COVID-19 within our community. There are currently about 10,000 cases of individuals that have had COVID within the last 21 days. So that signals about 10,000 people that are in our community that could be spreading COVID-19 that we know about. So we are still asking people to limit that activity, and when you do go out, continue to social distance, wear your mask, and wash your hands. Very similar to case numbers is our reproductive number. So as our case numbers decline, we will continue to see some relief with regards to how the virus is spreading in our community. Today's reproductive number is 0.92, and for the region it is 0.91. Also, hospitalizations, admissions here in Hamilton County continue to decline. We are now around 2 or 3 admissions per day within Hamilton County. Also, when you look at our regional hospitalizations overall, for a long time we were at 750 patients in our hospitals or more. This number I'm reporting this morning is 570 patients, so a nice decline. We are not yet where we want to be, but we will happily accept those numbers coming down. The same is happening with our intensive care unit admissions. They were up close to 200 per day within our intensive care units. These are now down to about 150 per day. So there is starting to be a little bit of breathing room. We have a long way to go still, but I think these are positive points to keep in mind. I'd like to shift and talk a little bit now about what's happening with vaccine within Hamilton County. There are many providers in our community that are continuing to work with those that are 75 years and older. As Commissioner Driehaus indicated, this week we are working with 48 providers and 11,000 doses of vaccine for those that meet that demographic that are 75 and older. Our goal is always to make sure that we're targeting our populations that need the vaccine and to make sure we're doing so quickly and safely. And I'm proud to report that is how the providers are reporting this process has been going. There are many healthcare professionals and public health workers that have worked tirelessly for the last year, and while they're still spread thin, I'm excited that many of these partners are part of the solution of vaccinating our community. Over the last week, my team has continued to work at these clinics, and I can tell you that the folks that are getting vaccinated are just so happy and thankful to have the opportunity to be part of the vaccination process and to finally have the opportunity to get vaccinated. My team is really uplifted from some of the stories that they're receiving, and I'm really thankful for the positive feedback we are receiving. My team's been working hard for over a year now on this pandemic, and so getting that positive feedback has been nice. So thank you to those that have been reaching out and sharing your stories with my team. I also want to reiterate, Commissioner Driehaus just shared, there are a lot of people that aren't getting vaccinated because there just is not enough supply. I would like to encourage everyone to continue with patience. We will continue to work our best to get vaccine to you, but it will take time, and we're very much dependent upon the Ohio Department of Health and the governor's office for how much vaccine we have here locally. We're excited for this work to continue in the weeks to come, and we will continue to do our best in making sure we get doses out to the community as soon as we get them. For reference, our office come Friday will have used up pretty much every single dose that we received this week on Monday and Tuesday. I think we received about 975 doses. On Friday, we will be down to 27 doses. And trust me, we will have an outlet for those doses as well. But this is just showing how quickly the work is happening, and we're proud to be part of the solution here in Hamilton County. So in conclusion, I do just want to say once again, thank you for your patience. We are very appreciative of our community's hard work throughout this pandemic. I really think Hamilton County has continued to be a leader with our efforts to socially distance, to mask, make sure we're keeping sick at home, and hand hygiene. And I'm looking forward to the end of this pandemic, but continue to be patient as we move forward. Thank you.
Thanks, Greg. Aren't we all looking forward to the end of this pandemic? Thank you. Thank you so much. So Renee Mahaffey-Harris is here. She is the president and CEO of Closing the Health Gap. And I don't know how long it's been, Renee, that you've been working on this, but trying to make sure that people throughout the community have the messaging they need to get, to understand what's happening in the community, to know what safe practices are, also to get signed up for the vaccine. So I'm going to turn it over to you.
Good morning, and thank you, Commissioner Driehaus, as well as Commissioners Dumas and Commissioner Reese. We are very fortunate to have an awesome Commissioner of Health. and Greg Kesterman. I think as he ended with patience, I think that's where I began with the fact that we need to continue to give each other grace during this time. Information is changing rapidly, and so I'm going to talk with you about a couple of things. I happen to be a part of the governor's vaccine work group, and in that weekly we are talking and hearing across the state about what the challenges are, what the opportunities are, and what's working well. So we're all learning from each other, and one of the things that we've been asked to do for the Health Gap for the state is to develop a toolkit. In our weekly conversations that are led by the Equity Director, Director Carmichael, what we've found is communication is the biggest barrier. You can get communication messages from your social media friends, and sometimes that information creates more confusion than help. And so what we are going to be doing is developing a toolkit that will be electronic, so that we can update that information as it is disseminated across the state of Ohio through a variety of community-based organizations, systems, and et cetera. Anyone that is interfacing specifically with the marginalized populations across the state of Ohio. But as we look to Hamilton County, we are frankly the model, I would have to say, in building communication. So since March 23rd is since how long we've been working, we joined forces with the African American Chamber of Commerce, the Urban League of Greater Cincinnati, the NAACP, and the Cincinnati Medical Association, along with City Council, and began to host town hall meetings to share information from experts. We have now conducted over 28 town halls since March 23rd, and the last 4 have been all focused on the vaccine. We had a town hall where we had a group of young people who said, I don't know if I want to take the vaccine, and here's why. And so, frankly, our messaging about we must save us and driving people to COVID-19communityresources.com has enabled us to get information out to people to counteract much of the information that, frankly, we're hearing in rapid ways and really not sure how to digest. The COVID-19communityresources.com site has really enabled us to post a fact sheet that we can update as frequently as new data comes available to us from Dr. Fauci and federal government. But what we do know is that information is delivered to individuals differently, and people receive information differently. And so we have been working very hard to work on messaging that cuts across all demographics, cuts across really the marginalized populations who have been disproportionately impacted by COVID-19 in the Black and brown communities and populations of our county. So we are really proud of the work that we've been able to do in conjunction with over 60 organizations in our county to determine ways that we utilize their influencers to create fact sheets and short messages that can be disseminated on their websites, can be disseminated through radio on a weekly basis, both in Black radio stations as well as Hispanic Latino radio stations and networks of communication. And so, we are all working together to figure out the best way to make sure people are informed. We will be back next week, I think, to talk a little bit more about the research we have conducted across the county to better understand how are people's lives being impacted by COVID-19, how, in fact, would they like to receive information as they look at the organizations that they trust or people they trust. What would those messaging and information need to look like for you to better understand why take the vaccine? We have heard nationally about the vaccine hesitancy within the Black community, and for many trusted and many valued reasons because of mistrust and the history. But we are working to make sure that our physicians, our Black physicians and Black clinicians and Black researchers are available to the community through our weekly town halls, through our video posts on social media, and really utilizing all of the many networks that we are blessed in this country to have right now. We have so many mediums that we can get information out through. Now it's making sure that we are learning from the community how they want to receive information. What's interesting, and I'll just share this one bit of information from the research that we'll be going into more depth on in a week or so. People said, we are hearing about the vaccine. We know that the process is not going as quickly as we would all like because of the production of the vaccine. But what I can assure us of is that we in Hamilton County have developed processes that enable people to sign up and then be informed when it is their time. Yes, the questions about why the governor and the state of Ohio decided to start at 80 and up and then 75 and up, that was really based upon the level of deaths and the rate of deaths in those being hospitalized and dying. At those older adults were having greater morbidity. Or mortality rather. And so that's the why. And, on our weekly calls, there's constant conversation about, why can't the number accelerate? And so, well, when the vaccine accelerates, I think the numbers will accelerate more rapidly. But I do know that we've built systems that will enable people to get information. Yes, we continue to be challenged on the barriers that from broadband and access to computers, but because of 211 and because of all of our incredible organizations across this community, we have been able to stand up those resources and those networks and that information through those sources. We have a lot of work to do, and if we continue to work together, I believe that the message that we have launched with over 60 organizations and with our partners in saying we must save us, and that means we must make sure that you understand that taking the vaccine is a part of stopping the spread. The other part of stopping the spread is that when you get that first vaccine, make sure you take the second. And then finally, because you took the vaccine does not mean that we no longer wear a mask. It does not mean that we no longer wash our hands, and it doesn't not mean that we no longer social distance. We must continue to do those preventative measures as the vaccine is disseminated in greater levels, and we must also make sure that we can be informed in a way that we can receive. And so we are again utilizing the local physicians, the local researchers that look like myself and look like other marginalized populations to make sure that there's opportunities to ask questions. Our weekly town halls are every other week, and this Saturday we have a town hall featuring the new president of the Cincinnati Medical Association, Dr. Shomo. We also will have Dr. Clyde Henderson, and he is a former retired orthopedic surgeon, and we will also have Dr. Lou Edgy, who is with the University of Cincinnati Medical School, and they will be on to ask questions, answer questions, hear concerns. If we continue to have those kind of dialogues and really not stop at the point of you must take the vaccine. Yes, we know you must take the vaccine, but people have questions, they have concerns, and what we have learned is that the more informed, because we've had people send us emails, because we are informed through the town halls, through the radio messaging, through the billboards, through the COVID-19communityresources.com site, I now have more information to inform my decision, because that's what we have to keep doing. And so we will continue to utilize all the platforms, all of the partners, all of our elected officials and health departments, both the county and the city, to make sure that we provide information, that we can answer questions, and that we are a resource to give that information in a way that people can receive it. I am so grateful for the work that we continue to do together, and again, I urge all of us to continue to be patient and give each other grace during this time, because at the end of the day, we all want to get to a new normal, which is outside of the pandemic, and understanding how we continue to build and maintain the relationships we've built during this pandemic, but we will get through. And I thank you for giving me the opportunity to come here today to talk about messaging. Thank you.
Thanks, Renee. And thanks for what you're doing here, but also your willingness to serve at the state level on these important committees to bring the perspective of Hamilton County. And you've just got such a keen understanding of what's going on in this community. So thanks so much for the work that you're doing and your willingness to serve. One thing that you touched on that I want to expand on just a little bit is capacity. So I just want to make sure that folks understand that as we do anticipate eventually getting more doses as they become available, both at the national level and the state level. Rest assured that not only do the hospitals have the capacity to vaccinate more people than they are right now, so does the public health department. And so we are set up right now anticipating an eventual increase in doses, and are ready to go. And I've heard that said of the hospital systems and of the public health systems. And so I just want to make sure that people understand that we're the day to come when those doses become available. We're ready to go. And one last thing, Renee, you touched on it. The criteria by which the governor is, he's thinking through this eligibility piece. And so while we don't have enough doses to cover all those that are being made eligible as we go, the rationale so far has been that 86% of those who have died from COVID-19 are over the age of 65. And so that informs the decision about who should be eligible for the vaccine. The teacher piece is a little bit outside of that, and I really can't comment to the rationale specifically of that, and I've been asked. But the rationale for those over the age of 65 is very clear, that they often have the most fatal or dire consequences from getting COVID-19 to begin with. So, all right, so with that, Bridget, I think we're ready for questions.
Thanks, Commissioner. Up first is John London with WLWT News 5, and he has questions for Commissioner Kesterman.
Yeah, Denise first, though, if I could, if that's all right. I'm sorry. Yeah, because you've laid it out pretty well, and I thought Renee did as well as to the situation where it's hard to plan for, you say, because you don't have consistent information about the amount of doses that you're going to be getting, 11,000 one week, 9,000 the next week. What explanation have you been given, if any, as to why there is not a consistent baseline level, Denise, of the amount of doses coming in?
Well, I think this is a great Kesterman question, but I do, the county commissioners do have a call with the governor every other week, and we are trying to better understand this so we can anticipate and respond. And so I think some of it is related to the national level and the doses that are coming in from that level. And you've heard President Biden talk about more doses. We just haven't seen that yet. But I'm going to let Greg expand on the question.
Good morning, John. So, I think Commissioner Driehaus summed it up. Ohio is limited to the number of doses that they're receiving from the federal government. I think each week the priorities that Governor DeWine makes as he's assessing how many doses go to each county shifts. So as we know, next week he's working on schools. So he's taking some of those doses that we were getting and shifting them to counties that are starting on the school population. The state is who is directing which schools go next, and so that is shifting some of those vaccine allocations. It does add complexity to our planning, but what I have continued to message and proud of my team is we are set up, we are ready, and the moment we get doses, we're able to work with our community to make sure that those that need vaccinated are able to get vaccinated.
Greg, the new administration mentions that FEMA is going to set up facilities for mass vaccination when those mass doses start to come in, school gyms, stadiums, convention centers. What locations are being looked at in Hamilton County, and would the sign up for this kind of thing be different for citizens?
Those plans have not been released at the local level from the federal government or the state level. There are many places here in Hamilton County that we could set up a location for that type of vaccination campaign. But the other thing I would share is that once those do get stood up, there most likely will be a process to get vaccinated through them, a registration process directly with the federal government for that type of a location.
And one other quick thing, one thing we've noticed is that the number of vaccine sites in Hamilton County that's listed on Ohio's recently launched COVID vaccine location finder website appears to have dropped by 3 from last week to today, 46 to 43. And I have to wonder what that's about, because some people might look at that and think that's not a good trend.
I suspect that's an updating issue. We actually found out that there are 2 larger pharmacy chains here in Hamilton County that will be receiving vaccine next week, which includes CVS Pharmacy and Walgreens. And so I suspect more information will come on that. But I think the number of providers actually will be greater than 48 next week.
Thanks. I'm going to step out of the way. I might have a couple more questions, but thank you.
Thanks, John. Next up, we have David Winter with Local 12, and he has questions for Commissioner Driehaus.
I believe it's Commissioner Driehaus. We'll give it a shot, and if you need to cast it off to Greg, please do. You able to hear me okay?
Good morning.
Good morning. Okay, so mine are in reference to schools, my questions. First of all, it appears that CPS has been able to leap ahead of all of the other schools in Hamilton County in reference to vaccinations. Why is that?
Again, this is a decision that's being made by the governor, and I don't know the rationale behind the decision.
So none of the school decisions are being made at the county level. Is that what you're telling me?
That is what I'm telling you.
Okay. Has there been an opportunity for the county to step in and lobby at all for any schools?
We have been, as I mentioned before, I'm on a call every other week with the governor, lobbying for what we know is working in Hamilton County. And so we are constantly lobbying the governor to make sure that we've got enough doses to accommodate the need. He simply can't respond to that in real, because he doesn't have the doses, right? And so he's making decisions about eligibility and distribution. I have advocated for Hamilton County, as the mayor has advocated for the city, and we'll continue to do that.
And then lastly, then along those same lines, it appears that most schools in Butler County have now been able to get in line for the vaccine. Why would they get in line for the vaccine before most of Hamilton County?
Again, not a decision that's being made at the county level. I mean, questions for the governor.
I understand, but what are your thoughts in reference to the fact that Butler County, most of its schools are now in line for the vaccine and Hamilton County is not? Seems like Butler County has been able to jump ahead.
I don't know what the rationale is that's being used by the governor. We are advocating that the schools in Hamilton County, both inside the city and outside the city, get prioritized. But all we can do is make sure that once it is our turn, we've got the capacity and the infrastructure to respond to that.
Okay, thank you, Denise.
Thank you. Next up, we have Corey Sharber with WVXU. Corey, questions for Commissioner Kesterman.
Good morning. I just wanted to ask, how's the new vaccine site doing? How many people have been vaccinated since it opened up?
I don't actually have an exact number of how many have been vaccinated out at the Board of Elections, but I can tell you I've been out there a few times now, and it is a fantastic spot. It's got plenty of handicap parking. It's got a handicapped ramp so that if you're in a wheelchair, it's easy to get in. It's a very clean and nice location, and plenty of space so that we can socially distance people out. I was out yesterday and we were vaccinating 475 people, and when I was there, it never once felt crowded. It was very smooth, and once again, you know, the feeling in these vaccination clinics is a feeling of thank you and hopefulness and excitement, because folks know that they're taking that next step to protecting themselves and their family as they're getting vaccinated.
I know that David, he was mentioning Cincinnati Public Schools receiving the vaccine. I'm not sure if it will affect Hamilton County's vaccine rollout, but is it affecting the county's vaccine rollout in any way?
We're continuing as soon as we get doses to get them into our community. At a high level, I've heard from several school districts and concerned parents, similar to what Commissioner Driehaus was saying. These decisions are being made at the state level. I will continue to advocate for our schools, but I also acknowledge that not everyone can go at the same time, and so that's a real point to keep in mind. I think the other item that I want to really emphasize, if I may, is that our schools are really important, but they are actually the first group of essential workers in Ohio to get vaccinated. And so they're actually going before law enforcement and many other professionals like grocery store workers that did not work from home for long periods of the pandemic. So I continue to ask everyone, as you're waiting in line to get vaccinated, patience, and realize that if you are having to wait an extra week to get your vaccine, please be patient and realize that everyone is doing the best we can to get vaccine to you.
Thank you.
Thank you. Next up is Ann Sinker with the Enquirer. Ann, who would you like to ask your question to?
Thank you. I'll address Greg first, since he's at the podium. Good morning. Thanks for doing this. Greg, are you anticipating that Hamilton County will turn color on the state map tomorrow?
Every indication that I look at and have shared today are all heading in a positive direction. So unless there's some delayed information getting to the state, I think we should turn red tomorrow. As of last Thursday, we only had 3 of 7 metrics flagged. Unfortunately, we still have high incidence of COVID, which means we can't go all the way down to orange. We're stuck at red until our high incidence decreases.
And Greg, as a public health professional, I mean, we're seeing the drop seems rather precipitous over the last 2 or 3 weeks. Is this, what do you think is contributing to that? Is it indeed, is the vaccine working back quickly within the population? Are we seeing, because we're attacking the older folks, fewer of them are going to the hospital? I don't mean attacking, but vaccinating them first. Fewer are going to the hospital, fewer are dying. What do you think's happening here?
Well, I'd like to take that in two parts. The first part is I really think we as a community have really continued to focus on those measures that we've been talking about since February, about masking, social distancing, and better hygiene. And so I'd really like to compliment all of Hamilton County for your work in that regard. I also think, though, we are pushing about 5.6% of our total population in Hamilton County having received their first dose of vaccine. And so vaccine is clearly going to start making an impact on our numbers. As Commissioner Driehaus shared earlier, the governor's plan worked first with those that live in nursing homes. And so if you think about our most vulnerable population, it's those individuals that are elderly in a congregate or close setting. And so I was talking with a nursing home executive last week, and he was indicating throughout the pandemic they would have 150 or more patients that had COVID-19. And that number has drastically dropped to 10 or 15 per day. So that type of an impact will clearly drive how many folks end up in the hospitals. And so we're excited to see more and more folks over 65 get vaccinated, as we think this will make a long-term impact on our footprint here in Hamilton County.
Great, thank you very much. My next question is for Denise, if I might have a moment with Denise. Thank you. Commissioner Driehaus, you may have read the stories over the weekend of Biden administration officials saying that when they finally moved in a week ago today, there was no national distribution plan in place to hand over, suggesting that there was no sort of guiding strategy from Operation Warp Speed or the White House. I guess that's something I sort of felt was happening, but didn't know for certain. Does this confirm what you know? What did you make of that?
Well, what I am hearing is the Biden administration talk about aggressively trying to get doses down to communities to get people vaccinated. I mean, that's what I'm hearing. I prefer not to comment on the previous administration and how they handled the pandemic, but what I know is that the Biden administration is committed to being as aggressive as possible, whether it's manufacturing of vials or production of the vaccine itself or the distribution infrastructure. They're tackling it right now as quickly as they can. And from my perspective, that's great news because that means more doses down to the local communities to address some of the complicating, factors down here where people are so anxious to get the vaccine and we just don't have enough of it. So I'm encouraged by the news coming out of the Biden administration about their approach.
I appreciate that, but with all respect, Commissioner, you've been talking about the decisions the state of Ohio was making, and those decisions were based on whatever they were getting from the federal government over the last 2 months. So, did it seem to you I understand you don't want to talk about that, but it is an integral component on how the distribution goes forward. So I'm asking you to evaluate, from your perspective, was there a national plan that you could discern over the last 2 months?
So when I was referring to the state level, what I was referring to was the criteria as far as who is in line, when they get in line, who is eligible. These are all decisions being made at the state level, and that's what I was referring to. And so when I get questions about why would one person be eligible and the others not, and does it make sense, and these aren't decisions that are being made at the local level, and we are just trying to adapt and respond to what's being decided with, as far as Governor DeWine is concerned, he's using medical evidence, he's talking to experts, he's doing the best he can. I just think that sometimes the logistics of it are complicated the further down you get because we're not making the decisions. So as far as what's happening at the national level, I think we all wish there were more doses. I can speak to the frustration that there aren't, but I think what gives us some hope is that there is a much more aggressive approach right now, from what I understand, and I'm pretty far down the pecking order, by the way, but I take some hope in that we're going to ramp up here, we're going to see that play out here, and eventually we're going to see that play out in Hamilton County. It's going to take some time, but at least we're heading in the right direction.
Right, and so either for you or Greg, are you the president yesterday promised an increase of somewhere in the neighborhood of 15-16% in the number of doses going out. Do you know at this point how that's going to be reflected in Hamilton County?
I mean, as far as numbers, I don't. I mean, obviously, we expect more doses, and that's why we've ramped up. I mean, and I've heard this from the hospital systems, too. They are getting, 1,200, 1,500 doses a week, something. I mean, it varies, as you know, week to week. They're capable of doing far more. You hear that from the public health systems, too. So, yeah, we expect more doses, and we have the capacity to administer those doses.
Thank you.
Thank you. We've got one last question from John London with News 5.
Yeah, Denise, for you and Greg, what would
Just kidding.
Denise, what would be the best advice from you and Greg for those who are 65 and older to sign up for the vaccine? And does it appear to you that we will go through winter and most of the spring with a shortage of what is needed?
My best advice for individuals at any age is to go to Test and Protect Cincy, because not only does it have the information about how you can get signed up, it also talks about eligibility. And so it's a rolling group of people. So it was 80-year-olds and over. Now it's 75 and over. Next week it's 70 and over, right? So you can get all that information on their website. And I think that's useful for people, because it is confusing because it's always changing. And then as far as when you're eligible, getting signed up, look to those icons and choose a couple of them. I would encourage people to choose more than one, and make sure that you're making that contact and getting in the queue so that when you're eligible, you get a call back and you get signed up. So that's my best advice. 2-on-1 for those that are not comfortable on the internet. And I think the next question was, and I might kick this one up, poor Greg, kick this one to Greg. Will we have enough doses to meet the need, or rather the folks that are eligible? That just depends on how many doses we're going to get, and Greg, I think, would be better equipped to answer this one.
Yeah, and I guess, Greg, I guess the question is, as you look at it right now, given what has been said by the new administration to try to ramp up, but clearly it's going to take time. I'm wondering, how much time in your mind do you think we're going to go through the entire winter and the entire spring before there is a sufficient amount of doses?
So currently there are only 2 manufacturers producing vaccine and distributing vaccine that have been approved by the FDA. And I think we won't see too much of a significant change in the number of doses that we'll see here in our community over the next month or two. There's a lot of talk that a 3rd vaccine manufacturer will get approval in mid-March. And if that happens, the vaccine that we're talking about is a 1-dose vaccine. We don't know the efficacy of that vaccine, but a 1-dose vaccine will significantly reduce the amount of supply needed and will hopefully increase the number of doses available nationwide and within our community. So I think we'll still be slow throughout the winter, but hopefully by spring we start to see more doses, and we're starting to get more people vaccinated. And as we get our elderly population vaccinated, we will continue to see decreases in hospitalizations as well as deaths within our community.
Thank you. And we do have one last question from David Winter with Local 12 for you, Greg.
Figured since you were at the podium, I might as well ask you a question, Greg. So in reference to Test and Protect Cincy, I just went on there. It said that schools should start getting vaccinated on February 1st. When in reality do you think our school systems will start getting vaccinations?
So the Ohio Department of Health on their website does have a list of all schools that will get vaccinated next week. That list is public, and Governor DeWine has committed that by the end of this week, so by Friday of this week, the complete rollout should be made available throughout Ohio. So that would be the best spot to look. I truly think come the 2nd week of February, we'll start to see some doses. But as Commissioner Driehaus indicated, we are at the mercy of the Ohio Department of Health, the Ohio Department of Education, and ultimately the governor.
And then as far as how those teachers will get those vaccinations, is that through the county?
I think there's going to be a variety of partners that will play a role. Currently, what I think the state is looking at for Hamilton County is using some private pharmacies to do some of the rollout, as well as many of our schools have a significant relationship with hospital systems through their athletic programs, and I think they will play a role. And public health has plenty of capacity for any school that does not have that partnership or ability to get vaccinated through one of those means. But every school in our community, whether it's a private school or a public school, will have equal access to vaccine for those that want it.
Okay, great. Thank you so much.
Absolutely.
And that seems to conclude our questions from reporters.
All right, well, thanks again to Greg Kesterman, a Health Commissioner of Hamilton County. I always forget to mention your title, Greg. And Renee Mahaffey Harris, who is the President and CEO of Closing the Health Gap. Thanks so much for your work, Renee, and all that you're doing for the community. So, and to Jay. Jay is, he's looking pretty good today. He's not, wasn't too stressful, I think. So thank you all. We'll be back next week.